Today's topic of discussion, ibogaine. What do we know about it? What do I know about it? First of all, I know it's a root that was like the ibogaine root that was derived from, it came from Africa. It's like a really important thing in Africa. They use it in a lot of religious ceremonies. And ibogaine is very useful in treating things like opioid addiction. Opioid addictions are a big problem right now. People will get injured, go to the hospital, get hooked on painkillers or opiates, and then be screwed for life because they're really addicting and they're hard to get off of. But if you have some kind of treatment that's, well, actually, okay, so the main treatment that they use right now to get people off of the opioids is something called methadone, or another treatment that I've forgotten what it's called. But methadone, the problem with methadone is it doesn't really get you off of opiate addiction. It just kind of like shifts it to the side, and then makes it so that you aren't like actually high all the time. So it's one of those things that's kind of useful for like short-term use, but if you have to use it for the rest of your life, which most people do, it's really kind of a bummer. But so ibogaine comes in as like a method that can be used to treat the opioid addiction. What else do I know about it? Oh, so the way that ibogaine was initially founded, in theory, according to this one guy, is that he was like, his name was, I don't even remember, I don't think I wrote it down. But he was hooked on, I want to say meth, but I can't remember specifically. And so he was hooked on this drug, and he was in some place far away, not in the US, and he was trying to get high, and then there was this, somebody was like, oh, you should try this stuff. It's a hallucinogen. He was like, well, I can't get my original stuff, I'll get this stuff. So he tried it, and then he was like, wow, it's incredible. And then he realized that his cravings for his usual drug were pretty much gone the next day. So a lot of the people are claiming some crazy things about this drug. They're claiming that it's like has an 80% efficacy rate. I don't know if I should say a lot of people. A lot of like the guy that went on Joe Rogan talked about this. He said it had like an 80% efficacy rate the first time around. Like if you used it one time, it would be 80% of people were like cured of their addictions the first time, and it was at like a 93% efficacy rate the second time that people used it. But none of the other people that I was reading about or like watching were saying that. They were all saying it was like methadone has like a 20% efficacy rate and ibogaine has like a 30%. But you don't want to just jump into ibogaine therapy or using ibogaine because it has some pretty serious things that can come along with it. There's problems. Like it can stop your heart. Also, it's like apparently like a really bad trip, like every time. Physically, it's like really demanding. You get like a lot of shaking and sweating, and there's a lot of stuff that happens that is not pleasant. So I think it's one of the reasons you don't want to just take it recreationally. It would be better to take it like with intent. Also, you really need, I don't know how the religious people are using it in like their religious ceremonies, but in every other country that has been using it as like a treatment for addiction or treatment for anything, because there's a lot of people saying that it's like a miracle cure for a lot of different stuff, depression, anxiety. There's some people that are using it to treat Parkinson's and dementia, I think, because it's helping to reform neural pathways that were kind of like damaged. It's like actually helping the brain physically heal itself. So you need somebody there to be monitoring your body and like making sure nothing crazy is happening while you're doing this, because there's quite a few people who have like, I don't know if I would say overdose is the right word, but it was a problem that their body couldn't handle and then they died because they were using it. There was one case in Mexico, I want to say, where this guy, which is weird because he was a dentist. It was like this dentist was offering ibogaine treatment at his clinic, and so this guy from Canada came down to get treatment for his depression. I think he was like severely depressed, so he came down from Canada and started doing the ibogaine treatment, but he was on antidepressants. And so the dentist doctor who was administering the treatment didn't take him off of the antidepressants, was just like, yeah, you can go home. It's fine. You're done with the treatments. Go home. And then he went home and died. Well, I don't know, because there's video footage of him, like of the nurse coming in and starting to administer CPR. It sounds like he was on antidepressants while he was still in the clinic. It was unclear. Anyways, so don't try it lightly is the moral of that story. Also apparently there's these in somewhere in Africa, I didn't write it down, but in Africa there's this drug that's like an upper that's super addictive, and all the people in Africa are addicted to this drug. not all of them, but there's a lot of people, and it's like really hard to get off of. And it sounded like it was kind of ruining people's lives. Although the people they interviewed were like, "Nah, man, it's not a big deal. I take it to help me get through the workday because I have a really physically demanding job, and I take it, and it doesn't affect me at all. It's a really good drug, and I like it." But then there was other people who were really against it, and it sounds like really the only way to get off this drug is using ibogaine or the iboga roots, which is like the derivative where it's derived from, not the derivative. So some things to consider. I mean, I have way more notes about ibogaine. I just can't remember them on the fly. Also, it's really hard to think and talk, and I don't like it. So if I do this, it's going to have to be the kind of thing where I have a lot of information off the top of my head, which is not my strong suit. So we'll see what happens.